Hello, hello. Good morning, good afternoon, good evening, wherever you are. Thank you so much for coming on to this call today for the show. My name is Patrick Hutzel from Intensive Care Hotline and Intensive Care at Home. Thank you so much again for coming on to today's Your Questions Answered Live. Before I go into today's topic, I want to welcome you on the live stream, or if you're watching the replay one way or another, I want to welcome you and thank you for watching the show and thank you for all your support. Today's topic will be about stroke in ICU after 2 strokes, high blood pressure. Can we be confident that my brother won't wake up? But I'll go into much detail there today. Before we go into today's topic, just you may wonder what makes me qualified to talk about today's topic. So again, my name is Patrick Hutzel, founder of Intensive Care Hotline and Intensive Care at Home. A little bit about me: I'm a critical care nurse by background. I have worked in intensive care and intensive care at home for nearly 25 years in 3 different countries. For the last 10 years, I have been advocating and consulting families in intensive care all around the world as part of intensivecarehotline.com. For the last 10 years as well, I have been managing and growing intensive care at home, a service where we send intensive care nurses into the home to offer long-term solutions for long-term, mainly ventilated and tracheostomized intensive care patients at home instead of intensive care. But we also provide services around non-invasive ventilation at home, such as BiPAP, CPAP, enteral feeding, home TPN, central line management at home, peak line management, and Hickman's line management at home. So anything really that requires an intensive care nurse outside of intensive care is what we offer with intensive care at home. Currently, we are operating all around Australia with intensive care at home, but we are also starting out now in the US. If you are in the US, you should contact us as well, so we can help you in the United States as well if you're looking for intensive care at home services, especially if your loved one is in LTAC or is on the brink of going to LTAC with ventilation, tracheostomy, or if you're at home already and you don't have good support, you have insufficient support. Anything really where it comes down to ventilation and tracheostomy at home, also non-invasive ventilation, home TPN, you should contact us. You can go to intensivecareathome.com and you can call the number on the top of the website that's applicable for your country. Right. Now also, as we go along today, you can type your questions into the chat pad, or you can call in live on the show. You can call the number with your country code. I typed the numbers in the chat pad, and you can dial in live on the show with your questions. But also those other numbers, you can get hold of us during any other time of the week. Okay, without further ado, let's go into today's topic and into today's main question. So I had an email from Margie, and Margie says, in your professional opinion, after 2 strokes and lingering high blood pressure, do you feel after being off the ventilator for 3 days, we can be fairly confident that my brother won't improve? In other words, he appears non-responsive. He's breathing fine on his own, but he doesn't appear to be cognitive. We don't want to prolong suffering if we know he wouldn't want to live in this condition. In your experience, do patients sometimes come out of this or show some sign of response the longer we wait? From Margie. Margie, thank you so much for writing in and wanting to get answers to this particular question. Now, I really break this down step by step So to give you my take on your brother's situation. So I'll start again. In your professional opinion, after 2 strokes and lingering high blood pressure, do you feel after being off the ventilator for 3 days, we can be fairly confident that my brother won't improve? Okay, let's just stop there. So your brother had 2 strokes and he's got lingering high blood pressure. So the first question is, what types of strokes did he have? Did he have ischemic strokes, i.e. a blood clot caused no blood flow to the brain, also known as an ischemic stroke? So he had a thrombus that blocked off the arteries to the brain and there was no oxygen supply to the brain. Was that the cause of the stroke? Or did the high blood pressure potentially cause a vessel to rupture, like an aneurysm rupture or an artery rupture or a vein rupture, and cause the hemorrhagic stroke, i.e. a bleed in the brain? So that is the first question here. The next question is, depending on what stroke he had, what was their initial response? I.e., did they do a thrombolysis if it was an ischemic stroke, right? Did they do an evacuation of the bleed in the brain if it was a hemorrhagic stroke, right? So those are the first questions. So it keeps coming back to what I keep saying over and over again, and to some of you I might sound like a broken record, but I do believe I need to point it out again. The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's part of what I'm seeing here, Margie, with your email, that your brother had a stroke, but what type of stroke? What was the first line response from the ICU team? Also, another piece that's missing here is, how old is your brother? What's his pre-medical history? Right? What medications is he on? Right? What are his blood results? What are the CT results, particularly the CT scan of the brain result? Or if they haven't done a CT scan of the brain, have they done an MRI scan of the brain? What are the results? What's the report looking like? Okay, because you want to get as much factual information as possible. My answer will be driven on facts. Next, has he had an EEG? Right, has he had an EEG done? EEG stands for electroencephalogram. So it's basically a measurement of the brain waves. Okay, so those are all critical components that would help me to conclude an answer for you. But let's move along. Part of that, what you're saying, do you feel after being off the ventilator for 3 days, we can be fairly confident that my brother won't improve? Okay, so this is a very negative statement that you're making here. You could have also written, after being off the ventilator for 3 days, we can be fairly confident that my brother will improve. It's one word that you could have written different, and it may make all the difference. Now, I'm not going to be any woo-woo here, but you cannot control what's happened to your brother. What you can control, though, is your outlook. Whether you look at it from a positive point of view or from a negative point of view, that is something you are in control of. Now, you have chosen at this particular point in time to take a negative outlook, okay? And that's okay, but I'm just throwing it out there. You could have also said in your email, we can be fairly confident that my brother will improve. It's just a change of words, a change in outlook, change in energy. Maybe a self-fulfilling prophecy, maybe. Just putting it out there and let you think about it. or anyone who's watching this for that matter. Okay, next. In other words, he appears non-responsive. Okay, so what does that mean, non-responsive? So one of the first things when I talk to clients over the phone in similar situations, one of the first things that I ask them is, what's the Glasgow Coma Scale? Okay, Glasgow Coma Scale, also known as GCS, is a neurological assessment tool that is often used for neurological patients in intensive care or outside of intensive care as well. A Glasgow Coma Scale goes from a scale of 3, which means someone is not responding at all, also known as a vegetative state, to a 15, which is someone being fully compos mentis, oriented, awake, right? So you watching this would be a Glasgow Coma Scale of 15. I presume I'm a Glasgow Coma Scale of 15 at the moment. And your brother would be somewhere between a 3 and a 15. Whether he's a 3 or an 8, I don't know, because you haven't given me enough information. But again, it comes back to that the devil is in the detail, and that general statements, don't really help in intensive care. What helps when someone is in intensive care is details, as much details as possible, getting access to medical records, either setting you up with questions to ask the intensive care team, or we talk to intensive care teams directly. I was just on a call to an intensive care specialist this morning with one of our clients, to ask questions on their behalf. And, you will notice then that I will ask questions that you haven't even considered asking, right? And it keeps coming back to the biggest challenge for families in intensive care. They don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Okay, so, again, what does non-responsive mean, Margie? Does it mean he doesn't open eyes? Does he mean he does open eyes, but he doesn't talk? Does it mean he responds at least to pain stimuli and anything in between? Is he, for example, coughing? You're saying he's breathing on his own, but another question that I have in those situations, is he coughing? Another question that I have in this situation is he having seizures, right? So, for example, if he's having seizures, does that potentially stop him from waking up? Are they giving him anti-seizure medication that also has a sedative effect? And is that stopping him from waking up? Is it the combination of having sustained a stroke, ischemic or hemorrhagic, plus the combination of some sedatives, either epileptic medications, or because he would have been in an induced coma for 3 days, is he still having sedatives and opiates in his system, right? So those are questions you should be asking. You shouldn't be asking, or you shouldn't be saying, can we be fairly confident that my brother won't improve? That's not a good statement to make. The statement needs to be, what questions have we not asked here? And, I'm here to break that down for you. Now, next, you are saying he's breathing fine on his own, but he doesn't appear to be cognitive. That's definitely a concern. But again, why is he not cognitive? Is it the stroke and the brain damage that has been sustained? Is it the sedatives and the opiates that are still in his body system that he can't get rid of? Right? Is it epileptic medication, anti-epileptic medication, seizure prophylaxis that with the sedative effect that also keeps him sedated? Next, you are saying we don't want to prolong suffering if we know he wouldn't want to live in this condition. Okay, Margie, 3 days in ICU is not a long time. Not a long time at all. If you came to me with this situation and it would have been 15 or 30 days, I don't think I would be having a different response to you, right? 15 days in ICU, not a long time for someone with a stroke. 30 days in ICU, depends whether that's considered a long time in ICU for someone with a stroke or not. The question is, how long do you give someone to wake up? How long do you give someone to improve after a stroke? I'll ask you another question. For any of you that have children, how long do you give your child to learn to walk? 12 months? 18 months? 2 years? 3 years? Would you at any given point in time say to your child, well, stop learning to walk? Probably not. You will say, well, my child is going to walk no matter what. So let's bring it back to our question here from Margie, where she says, where she says more or less, how long will it take to wake up for my brother? How long will it take for him to improve? 3 days? 15 days? 30 days? 30 months? 30 weeks? I don't know. I don't know. How long will you give him? That's the question. That is the question. You say we don't want to prolong suffering if we know he wouldn't want to live in this condition. Okay. Recovery in intensive care probably takes a certain element of suffering. Okay, the question is, how much is someone willing to take? Also giving you some numbers here, when you look at the statistics, approximately 90% of intensive care patients survive. Approximately. Okay, so the odds are in your brother's favor that he will survive. Now, you're saying we don't want to prolong suffering if we know he wouldn't want to live in this condition. Now, do you know that for certain? I assume your brother can't make any decisions for himself at the moment, and I guess I get it that you and your family need to make decisions on his behalf. Would he want to live in this condition? I don't know. You know your brother. You have the best inkling whether he would want to live or not. Does he have a living will? Does he have an advanced care directive? Those are questions that I would want to know. What do you know about your brother that leads you to a conclusion whether he does or he doesn't want to live? But I can assure you that recovery in ICU for most patients will take some degree of suffering. And most patients are okay with that. People are incredibly resilient from my experience. Incredibly resilient. You've got to give them a chance to be resilient, though. 3 days in ICU is absolutely nothing. Absolutely nothing. And I think your first sentence where you say, after 2 strokes and lingering high blood pressure, do you feel after being off the ventilator for 3 days, we can be fairly confident that my brother won't improve? Again, I would change that sentence to, we can be fairly confident that my brother will improve, because it's only been 3 days. I argue there will be some improvement, because 3 days is not a long time. So let me illustrate that to you. So let's just say last week, yes, I can give you a very good example here. Last week, I was talking to a gentleman who had their 63-year-old mum in ICU after double valve repair and replacement, right? And open heart surgery. When I'm referring to valve, I'm referring to heart valves. One heart valve was repaired, one heart valve was replaced. And he rings up and he says, look, my mum's been in ICU for 7 days. She had the valve repair, valve replacement. She's been off the ventilator now for a couple of days, but she's very slow to recover and she's barely talking. Well, your mum just had her chest cracked open right, had a lengthy surgery, very lengthy surgery, and now she's slow to recover. Well, that's fair enough. That's fair enough. You know, she's just come out of prolonged surgery, prolonged induced coma, had heart surgery, had her chest cracked open, right? So she's allowed to recover in her own time. Good news for this lady was she's off the ventilator. You know, she's obeying commands. You know, she's slowly waking up. She's just slow. You know, you got to give people time. You got to give people time. That's the secret. Also, Margie, you got to bear in mind, you know, God forbid, if your brother doesn't improve, you can still start talking the discussions about end of life and about palliative care. Again, but there's no rush. If, God forbid, your brother dies now, there's no return from that as far as we know. But if you give your brother a chance to live, and yes, is there going to be some suffering? Sure. Is it worth the suffering to live? I can't answer that question for you. But this is something you need to evaluate here very carefully and not jump to conclusions after only 3 days in ICU. So last sentence is, in your experience, do patients sometimes come out of this or show some sign of response the longer we wait? Yes, exactly. Exactly. In your experience, do patients sometimes come out of this or show some sign of response the longer we wait? Yes, absolutely. You know, it's a bit of a cliche when people say time is a healer, but I also believe it's true. Now, will your brother recover to the point where he is the same person than he was before? I don't know. I don't know. Does he deserve a chance? I think so. You haven't shared how old your brother is, but you know, again, I keep coming back to how long do you give your child to learn to walk? For as long as it takes. I think we can be confident on that. Now, also, what you should be doing here is, Margie, you should be talking to a neurologist as well, right? Get it from the neurologist. Let them evaluate the CT scan of the brain, the MRI scan of the brain, look at the report, you know, look whether he's had an EEG. Now, here is another example to illustrate your brother's situation. So a lot of patients in ICU with a stroke are not coming off the ventilator after 3 days, right? They often get off the ventilator maybe after 3 weeks. So from that perspective, I think you have reason to be confident here that your brother might improve, right? Just to put it in perspective for strokes in intensive care, you know, sometimes we're having clients that have loved ones in intensive care for 3-4 weeks, and they have a trach, they're ventilated, you know, and yet they are neurologically improving. Lastly, Margie, so sometimes patients, let's just say, you know, I gave you an example a minute ago with open heart surgery. Sometimes patients are in an induced coma for a few days, and then, you know, they don't have any brain damage, they don't have a neurological event, and then they're not waking up, even though their brain is fine. It could be because, you know, they had too many sedatives and opiates on board, right? And if that's the case, then, you know, they're still not waking up because they're sick. They're critically ill. You got to give them time. You know, if you read some blogs from ex-ICU patients, sometimes they say, well, it's been 12 months since I'm out of ICU and I'm still not the same, but I'm glad to be alive. Now, another thing that you haven't said, Margie, is, you know, what's the response from the intensive care team? Are they positive? Are they negative? You know, it's a good chance the intensive care team is negative and is trying to push you and your family towards end of life. Why is that? Well, it's probably because, you know, they need the bed. You know, it's probably because there's a lot of pressure from them, staffing levels, bed management, and it's their default to be negative to protect their downside. What's their downside? Their downside is that if they tell you we'll treat your brother for the next 3 weeks for the stroke, then he will get out of ICU and get onto rehab, and then it doesn't happen that way. You could potentially sue them. So there's so many variables here, Margie, that you got to look at this situation from many different angles. Now, another thing that I haven't elaborated on, again, does he have an advanced care plan? Maybe he does have an advanced care plan where he says, well, no matter what happens, I want to have every resource used to help me get out of this. Or maybe he has an advanced care plan where he says, if I ever have a stroke, I don't want to live. Either should be respected. In the meantime, I know it's difficult for you and your family to make decisions on his behalf, assuming he doesn't have an advanced care plan. But from an intensive care perspective, there's a lot of missing links here. Again, where was the stroke? Was it an ischemic stroke? Was it a bleeding stroke, a hemorrhagic stroke? What was first-line treatment? Well, if there was no first-line treatment, how are they treating it now? Is he on a heparin infusion? Does he have a history of AF, atrial fibrillation? Is that what caused the stroke? If he does have a history of AF, atrial fibrillation, or AFib, how are they treating it? If it's being treated at all. A lot of unknowns here, Margie, and I hope I was able to help you with this and shed some light so that we can now move on to the next question. And again, if you want to, if you have a question, just type it in your chat pad, or call in live on the show. I put the phone numbers in the chat pad. Also, if you're watching this on replay and you have a question, you can either put it below the video here, or you can just send us an email to support@intensivecarehotline.com, or you can just call us on one of the numbers on the top of our website at intensivecarehotline.com. Okay, now next question that we had this week via email. Okay, here's an email from Roshan. Roshan says, my daughter has been in ICU on the ventilator for 3 weeks. They have inserted a tracheostomy. However, they have taken her off the ventilator and giving her oxygen through the tracheostomy tube in her throat. My biggest concern is she's not waking up. Okay. Thanks, Roshan, for sending that email. Similar to the question we had before from Margie, what happened leading up to this? Why has she been on the ventilator for 3 weeks? Why has she been on the ventilator for 3 weeks? Why has she had a tracheostomy? Right? Now, let's look at the good news here. The good news is she's coming off the ventilator. So the purpose of a tracheostomy is often to help someone wean off a ventilator. Okay, so with this purpose in mind, she seems to be doing well. She's off the ventilator and she's having a little bit of oxygen via the tracheostomy, probably through a trach collar or a trach mask, in combination with humidified oxygen. So that's really good news. Okay, the question is, why is she not waking up? Again, like in our previous question from Margie, has she had a stroke? Has she had a traumatic brain injury? Has she been in an induced coma for something else that's not brain related? And is she not waking up because she was in an induced coma for a prolonged period of time and she has no brain damage? You have not shared any of that. Next question is, if she's not waking up, is she getting stimulated? Is she having physical therapy? Is she getting good nursing care, good mouth care, good bed baths? Is she having a shower, for example? People in ICUs can have showers. It's work, it's physical labor, but it's definitely possible that patients can have showers. Next, what medications is she on? Is there something that's still keeping her sedated? Right? Again, similar to our other example a minute ago, where we had the question about the stroke in ICU. Is she having seizures? Is she potentially having anti-epileptic medications, anti-seizure medications that keep her sedated? Is that why she's not waking up? Again, the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. So, in your situation here, Roshan, it's clear that, there are many pieces missing. With a question like that, you're probably giving me 10 to 20% of the information I need to know in order to help you. And what we need in a situation like that is either talk to the doctors and nurses directly, or set you up with some questions, or ideally get access to the medical records, or ideally a combination of all of it, right? That would be the best way forward in a situation like that, because everything else is just a lot of speculation. We're trying to educate people here, families in intensive care, that they should get access to medical records as quickly as possible, that they should contact us as quickly as possible when they have a loved one in intensive care, so we can get down to the bottom of things. So I hope that helps, Roshan, in terms of your question for your loved one. Okay, let's get to the next question from Charlene. Charlene says, my mum is currently in ICU and has been on the mechanical ventilator for 11 days now. Her lungs aren't strong enough to breathe on her own. She was rushed in from antifreeze poisoning. She's on hemodialysis and has started to wake up and she's looking around, responding and move. But because the ventilation is causing her so much pain and discomfort, she's getting extremely agitated, making her blood pressure go up. So they just resedate her, which makes her lungs stop working completely again. But they're refusing the tracheostomy, which I think would be extremely beneficial, as she would be able to mouth words and not have keeping to be sedated, as she's already jaundiced from liver damage. So giving her all this sedation and pain relief is killing her. How do we go about trying to convince them to put a tracheostomy in, as at this point I really don't think they care to try and help my mum recover? Okay, that's a really good question, Charlene. 11 days now. So a tracheostomy should be done between day 10 to day 14 after inability to wean off the ventilator. So I'd say your mum has reached sort of this critical point, this critical threshold to have a tracheostomy done. By the same token, and she's stuck in a vicious cycle where if they're trying to wake her up, she's fighting the ventilator, she's agitated, so she's probably not ready to wake up, right? So in this situation, it's probably not a bad idea to do a tracheostomy, and here is why. So when someone is on a ventilator and with a breathing tube, can't come off the breathing tube, is being sedated for 11 days now in your mom's situation, a tracheostomy can be done and then sedation can be stopped. And because patients, generally speaking, can tolerate a tracheostomy without sedation and opiates, the reason patients are sedated and on opiates in an induced coma is simply because they can't tolerate the breathing tube. It's very uncomfortable. Okay, so therefore, patients, need to be sedated, and after day 10 to day 14, a tracheostomy should be done. Again, every day in an induced coma causes deconditioning of the body, and every day in an induced coma makes it harder for patients to wake up and also then recover, because there's so much deconditioning, so much muscle wastage. So doing a tracheostomy now, get her out of the induced coma, start the rehabilitation process with physical therapy, breathing exercises, mobilization, should help her to wake up and get off that ventilator as quickly as possible. Also, like you said, you hitting the nail right on when you're saying, well, with liver failure, she should not get all these medications. She should have a tracheostomy and then wake up. I agree with all of that. Now, sometimes what can stop people from having a tracheostomy is simply maybe she's on high ventilator settings, so maybe PEEP is too high. Maybe oxygen levels are too high, like the delivery from the ventilator. Maybe oxygen levels are at 50%. Maybe she's got a poor anatomy of her neck. Maybe that's delaying a tracheostomy. Maybe she's got too many secretions, right? So there could be a number of things why they can't proceed with a tracheostomy yet. I don't know, you haven't shared that. So, but just this is food for thought for you, why they may not be able to proceed with the tracheostomy. Ask them, ask the questions, or contact us and we can ask the questions on your behalf. And depending on what they tell us, we have counter questions. And as part of the conversation, we can react appropriately to anything that's happening clinically with our experience. So let's move on to the next question. From Shan. Shan says, hi, my dad is in ICU after having a severe asthma attack. He's on a ventilator and he does have a brain injury from lack of oxygen before the ambulance got to my dad's home. He's been in the hospital now for about 3 weeks and they took off his sedation, which was propofol. About 4 days ago, he opened his eyes a little, but has not fully woken up. How long does it take someone with a brain injury to wake up? That's a great question, and similar to Charlene before, it really depends. 3 weeks in ICU is a fairly long time. You have not shared whether your dad has a tracheostomy or not. You have not shared whether he's still ventilated. You haven't shared any of that. But it really depends. Also with an asthma attack, there could be issues around CO2 levels. Are CO2 levels within normal limits? And if they're high, for example, it may also delay waking up in this situation, right? And also, what I forgot to mention for all of the questions that we've had so far, Margie, Charlene, and Roshan, if your loved one isn't waking up and is therefore meant to stay in ICU indefinitely, well, that's when you should start looking at solutions like intensive care at home, right? With intensive care at home, long-term treatment at home is possible, and you should be looking at intensivecareathome.com, and you should contact us there if you need, the care at home instead of an intensive care. We can help you with that. So, coming back to Shan's question. So again, if there's been lack of oxygen to the brain, please make sure they've done an MRI scan of the brain, an EEG of the brain, a CT scan of the brain, and find out how much brain damage there is talk to a neurologist, right? And now the question is, okay, 4 days ago, it's been 3 weeks, 21 days. 4 days ago, he's opened his eyes a little, but has not fully woken up. How long does it take someone with a brain injury to wake up? Again, similar to what I said before, Shan, how long does it take to wake up? Well, probably as long as it takes. It would be good, again, to have more information, look at medical records, find out what else is happening, with the brain injury. Is your dad on sedative medications, still on opiates? Is he having anti-epileptic medications? Those are all questions that need to be considered here in order to find an answer. How long will it take to wake up? Is your dad getting physical therapy? Has he been in an induced coma so far because they couldn't do a tracheostomy, or they haven't done a tracheostomy, right? So many unanswered questions here as well, that we would need to elaborate on before we can take the next steps. Okay, in a situation like that, again, it would be very valuable if we can talk to the doctors directly and ask all those questions, get blood results, get CT scan results, get a list of medications. If he's been on propofol, that's probably a good sign, because propofol is a short-acting sedative. If someone is on propofol and it's being stopped, they should wake up as quickly as possible, because but if he's not waking up, then that could also be a sign that there is some form of brain damage after obviously the brain injury from lack of oxygen. Right. So, and again, coming back like to the previous questions, if your loved one doesn't wake up and needs ventilation or airway assistance with a tracheostomy, or needs BiPAP or CPAP ventilation, you should contact us at intensivecareathome.com. And we are currently operating in all over Australia. You should contact us if you're in Australia, but you can also contact us if you're in the United States. We can refer you on to other providers in the US if you have a need for that. Okay. Other question. So, my son had an overdose. That's from Julie. My son had an overdose around 2 p.m. and is still unresponsive. He's in ICU and intubated. How do we find out if he had brain activity? Because being a vegetable is not alive for anyone. Okay, I can see panic sense here from this email. This is an email from last week. Obviously, this lady, Julie, emailed us on the same day when her son went into ICU after a drug overdose. And, it's only been a few hours, and she's already talking about being a vegetable is not alive for anyone. Again, after only a few hours, you should not jump to conclusions. You should be grateful that your son is now in the right place. And you should be grateful that, he's obviously in good hands and that they're looking after him. Also, if they put him on a ventilator, he's now probably in an induced coma. And he's on sedatives such as propofol, midazolam/Versed, maybe ketamine, some opiates such as morphine or fentanyl, which means you cannot determine really without a CT scan of the brain or an MRI scan of the brain whether he's got brain activity or not. And labeling your son as a vegetable after only a few hours, I don't think that will do you a favor. Does that become a self-fulfilling prophecy if you give your son that label? I would maybe say, how long will it take for him to recover? That's a different question to ask. I would not use the word vegetable for anyone, especially for someone you love. I would not use that word. Also, then I had a follow-on email, when I initially responded, and she says, "Thank you so much. People don't realize there's help like you out there. I stumbled across you accidentally." I don't think that people stumble across us accidentally, not at all. I think that there's people that there's things leading you to us. And I'm glad I did. Families need to be giving a brochure with your details on arrival to ICU, letting them know there is help out there. It's not pushing it on families, just letting them know there is help out there. And I'm sure hospitals would rather speak to you, who know the language and medical conditions, instead of constantly speaking to families, asking stupid questions and the wrong questions. It would free up the doctors and nurses' time to focus on the patient and not worried, scared families. And have you relay it all in a language they understand, especially when it comes to turning a machine off and donating organs or keeping machines on longer. I personally feel hospitals turn machines off too quick for organ donation. You're doing a good work. Keep up the good work. From Julie. Well, thanks, Julie, for those kind words. Yes, and I think you're spot on in what you're saying here, that hospitals should be grateful for our service, and some are. I can tell you that some hospitals are. They very much appreciate having me on a call or having us on a call, so we can actually help the families understand what's really happening, because hospitals don't have the time. The doctors and nurses are very busy, and we can explain it to families in real time, in their own words, so they can understand it in layman's terms. That's really what we do. And you're right when you're saying families are asking the wrong questions. Exactly. It takes a lot of knowledge and experience to ask the right questions. And no hospital should switch any machines off without your consent, right? So that's what it really comes down to. Not to switch any machines off. It comes down to making informed decisions. That's what it comes down to, and that's what I'm here to help you, making informed decisions. Coming back to your son's situation, really, you need to give this time. You need to wait a few days, probably a few weeks, to see where this is going. It's way too early. Again, I would hope that they've done a CT scan of the brain or an MRI scan of the brain on admission to find out his brain activity. So I hope that helps. Give it time, look at his hemodynamic status, look at his blood results, look at the medications he's on, look at ventilator settings, look at things like, is he potentially withdrawing from the drugs? Is he going through withdrawal? And is that keeping him in an induced coma for longer than necessary? Those are all questions you need to ask. Okay, I'm going to wrap this up for today. Thank you so much for coming on to the show. It was great to have you here. One way or another, I'll do another YouTube live next Sunday the 19th of March. It'll be 10:30 a.m. Sydney, Melbourne time on a Sunday, which is Saturday evening at 7:30 p.m. Eastern Standard Time, which is 4:30 p.m. Pacific time. Right. So, if you have a loved one in intensive care and you have more questions, please contact us at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. Also, if you have a loved one in intensive care long term and you're looking to go home with intensive care at home, you can contact us at intensivecareathome.com. And you can call us again on one of the numbers on the top of our website, or simply send us an email to info@intensivecareathome.com. Again, with Intensive Care at Home, we are currently operating all over Australia, and as well as in the United States. You should contact us whether you're in either country. Now, also have a look at our membership for families in intensive care at intensivecaresupport.org. There you have access to me and my team 24 hours a day, and we answer all questions intensive care and intensive care at home related. Also, If you need a medical record review, please contact us as well. We help with medical record reviews for patients in intensive care or after intensive care. We also might write medical reports to get funding for intensive care at home. So if you need either, you should contact us as well. Now, thank you so much for watching. Subscribe to my YouTube channel for regular updates for families in intensive care, plus usually one YouTube live per week. Share the video with your friends and families, click the like button, click the notification bell, and comment below what questions you have, or if you want me a specific video, please reach out. I also offer one-to-one consulting, of course, over the phone and via Zoom. I talk to families and ICUs directly on your behalf, so please contact me for that if you need that. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you again in a few days. Take care for now.